Dr. Saundra Holseth with Releve Sports Medicine. Today we are going to be showing and demonstrating some of the OMT for the sidelines providers. Simple techniques that you can do for athletes when there's a complaint of pain. The first one we're going to do is an AC dysfunction, and we're going to do some muscle energy for it. So as the provider, I'm going to be behind the seated patient. I am going to be standing on the side that is affected. So in this instance, I am going to be on the left side. My right hand is going to be on that distal clavicle, and I'm going to kind of grasp the patient at the elbow. The next step is I'm going to go out into abduction, and I'm going to give a little bit of compression from the elbow to the clavicle with that external or left hand. Then I am going to perform abduction of the shoulder to the restricted barrier, and the patient is going to push into my hand in a controlled fashion. I usually tell them about 25 to 50% of their strength. So go ahead and you're going to push your elbow back into my hand. So go ahead and push. 1, 2, 3. Relax. Bring them into the next restricted barrier and repeat. So go ahead and push. And relax. And again, put them in that restricted barrier, have them push. And relax. We neutrally put them back into position, and we recheck that AC dysfunction. Each time you do a muscle energy technique, you have them hold that contraction for 3 to 5 seconds and repeat 3 to 5 times. Next. All right, so this next one is for glenohumeral joint. This can be done in a seated fashion, or it can be done with the patient laying prone. I'm going to have her in a seated position. This is called a figure 8 articulatory technique. So I'm going to have you hop on this side of the bed there, and I'm going to sit next to you. All right, so with this one, you can be seated next to them. If they are prone, you have their arm hanging off the table, sitting on that side. I'm going to take my thumbs, and they're going to be on the anterior and posterior side of that glenohumeral tubercle, and then my fingers are going to be into the axillary as well, and I'm going to apply a little bit of traction down with the arm, put it out into a little bit of abduction, and then what we're going to be doing is moving into abduction, adduction, circumduction. And so you're going to be creating a figure 8, just really relax, let me have your arm, movement up and down with that shoulder. And you're going to do this until you start to feel increased laxity in that. I usually do this about 8 to 10 times in the superior inferior position, and then I actually go into an anterior posterior, almost like you're making the infinity symbol, but same thing, still making a figure 8 in that anterior posterior position. And then you recheck. Go ahead and hit next twice. Next, we're going to come to the elbow, and we're going to be looking at that medial and lateral epicondylitis. Hit the next. And so for the elbow, for like a posterior radial head, which we tend to see with that medial epicondylitis, you can be seated next to or in front of the patient. And you're going to hold the patient's hand almost like you're giving them a handshake. And that's where you're going to give resistance to. At the elbow, I'm grabbing at the condyles on each side, giving a little bit of pressure. What we're going to do is we're going to put the patient into, we want them to supinate against a restrictive age. And so I'm going to pronate them a little bit to that first barrier, and you tell them to try to put their palm up. And so 25 to 50% of your strength, go ahead and try to put palm up. And relax. We're going to go to that next barrier. Again, push. Relax. And once more. And relax. And then we recheck. Go ahead and hit next. Very similar for lateral epicondylitis. Next. What we're going to do is, instead of trying to get them into supination, we're going to get them into pronation. You can hold the hand very similarly if it's comfortable, or you can actually put more pressure and hold at the wrist for this one. So for me, it is more comfortable handshake. Her hand fits well with mine, but if it's a bigger person, a lot of times I will come and hold at the wrist just to prevent them from being able to move. And so what you're going to do is put her into supination. The anterior head is going to actually be now where we put our thumb right over that radial head, and we put a little pressure, put them into 90 degrees of elbow flexion, put a little pressure down towards the ground. And what she's going to do is she's going to try to put her hand into pronation or put the palm down. All right, so go ahead and try to bring your palm down and relax. Go to the next barrier, palm down, relax, next barrier, and relax. And then we always recheck. Next. So contusion to the interosseous, or that forearm, can be very painful, but we can also get some tightening of that interosseous in racket sports or ball sports where we've got to be gripping a lot. And so we're going to release that with a myofascial technique, that interosseous in between. So for this one, it is ideal to be standing next to or in front of, just to get good positioning. But the patient's forearm is where we're going to start. Now you can start top and go up, or you can start up and go down. And so what we're going to do is we are going to have our thumbs next to each other along the forearm, and we are going to be doing compression and rotation. Compression and rotation. And then we work our way down, and I usually do 2 or 3 and then move down, and we're hitting that interosseous right in the center. And then I like to go back up to the top and do it all over again, but again, you can go top down and then bottom up. You can go bottom up to top. Yeah. And the recheck for this is simple. You can just have them grip your hand or grip whatever their racket sport is. Next. All right, for the wrist and hand, we're going to use a myofascial release. And this is great if they have carpal tunnel syndrome, or if they even get just any carpal discomfort. Again, we're going to be on the side of the affected wrist. We are going to have their palm up. We're going to be gripping their palm, and I usually will like to go, especially if their hand's bigger than mine, in between the thumb. Her hand's about the same size as mine, so I can go over the thumb, but either wasn't is fine. But what you're going to be doing is palms are going to be at that carpal junction. The underside is going to have my index fingers on the opposite of that. And what we're going to be doing is a compression and outward release. And we walk down those carpals. You can even walk into the metacarpals for this and just opening it up. Widen out over the palm with each rotation that you do. Sometimes I will add in a little bit of wrist flexion and extension to help with this, depending on how tight that carpal area is. This is done for about 20 to 60 seconds until you feel good release, and you always want to recheck. All right, we're going to stop the video.